The goals of diabetic vitrectomy are to relieve anteroposterior and tangential traction while avoiding or minimizing iatrogenic retinal breaks and maintaining hemostasis. The use of bimanual technique using forceps and scissors with chandelier illuminating system to dissect, delaminate and segment diabetic membranes will be outlined in the following video. In diabetic membrane peeling, the surgical algorithm is somewhat different from standard vitrectomy. After performing anterior vitrectomy, a complete sectioning or truncation of the posterior fibrovascular proliferation is performed by circumferentially cutting the vitreous attachments around the area of epiretinal proliferation. Bridges of fibrovascular tissue connecting epicenters of adhesions are excised using the vitrectomy probe. An additional 25 gauge port is created for the chandelier illuminating system, and superior sclerotomies are converted to 20 gauge sclerotomies to aid bimanual dissection. 3 techniques or combinations thereof are commonly used for epiretinal fibrovascular membrane dissection, including segmentation, delamination, and en bloc dissection. Segmentation can be seen being performed here. It is done by placing one blade of the scissors between the retina and the membrane, while the other is anterior to the membrane. A curved scissors is far more superior for segmentation because the blade width is much greater than its thickness and requires less space between the membrane and the retina as compared to vertical scissors. For delamination using bimanual technique, the edge of the fibrovascular membrane is reflected using an end gripping serrated forceps. This allows the epicenters of adhesion between the retina and the fibrovascular membrane to be visualized. These epicenters are then amputated at the retinal surface using scissors. Here, further segmentation and delamination is being performed. The trimmed membranes are then removed with a vitrector. Bleeding often is a problem during segmentation. Raising the intraocular pressure can be used temporarily to control intraoperative hemorrhage. This technique is continued until all of the fibrovascular tissue has been removed up to the optic nerve head. Unlike performing segmentation alone, membrane dissection using delamination technique leaves minimal or no epiretinal tissue on the retinal surface. Now, fluid-fluid exchange is being performed. Here, the membranes around the pre-existing retinal break are being removed. Now, A fluid-air exchange is being performed through the pre-existing brake using a silicone soft-tip flute needle. Following this, laser photocoagulation around the brake and additional pan-retinal photocoagulation is performed. Silicone oil is then injected, the microcannulae are removed and ports are closed. From this video, we learnt that bimanual vitrectomy is a safer way to handle complicated membranes in diabetic tractional detachments and witnessed successful reattachment with least trauma to the retina.